I'm Jessica.
Hi, I'm Megan.
And I'm Nolani.
And we're from the Practical Nursing Program at McFatter High.
PSA, this is about mental health.
And this will include anxiety, depression, and suicide.
Oh my god, I got a B. I have to show my mom. Mom, I got a B on my test. This one was really hard and I studied a lot for it, so I'm proud.
You should do better. You know how I feel about bees. Honestly, you're grounded. No going out, no car, no friends. I'm telling your dad, go to your room.
But...
No, I don't want to hear it. You should have been better.
Okay.
I like your sister more.
Okay.
You're worthless.
Okay.
Who's calling me? Hello?
Hey, Jessica. Can I talk to you real quick?
Hi, Yin Yang.
Bro, my mom, she's so mean, bro. Like, I worked so hard in this test, and she's not even proud of me. Like, what does she want? There's so much I can do. I worked so hard.
I think your mom is right, though. You do need to aim higher. Who cares the test was hard? I think she's really right, and you need to do better and work harder. An A is what you should have strived for. A B isn't worth it. You're worthless. Bye.
I'm worthless? I'm... Wow.
Okay.
Bro, my mom, she's so mean, bro. Like, I worked so hard in this test, and she's not even proud of me. Like, what does she want? There's so much I can do. I worked so hard.
Your mom should have been way nicer about this situation, especially since you put your best foot forward. If a B is all that you've gotten with your best effort, that should have been okay for her. And it's okay for you. So,
Thank you for your kind words. I'm glad I could always count on you. Thank you. You're a great friend. Class, so today we will be doing addition equations. So first off, we'll start with 2 plus 2. Okay, who can give me an answer?
oh no, please don't call on me, please.
Jessica, could you come up to the board, please? Does it really take all that now? That is not correct. Try again.
Can you call on someone else?
No, you should know this. I taught this.
I can't believe I don't know how to do this. She just taught it. I'm very anxious right now.
Do you even pay attention in class?
Yes.
No, why don't you know the answer?
Math isn't my strong suit.
But I just taught it.
Is it 2?
No, it's not. Go back to your seats. Hi, I'm Yang, and I'm going to be talking about the signs and symptoms of anxiety, depression, and suicide. The signs and symptoms of anxiety are feeling tense and feeling an impending sense of doom all the time. You may have trouble concentrating since you're always constantly worrying. Additionally, you may have trouble sleeping. You might also have GI problems or gastrointestinal problems since you're always in a stressed state. Tachycardia, which is increased heart rate, and then hyperventilation, which is breathing rapidly, also trembling and sweating.
I'm going to be giving you some tips on how to avoid anxiety. First, seek a healthy lifestyle. Exercise regularly and eat well. Get help when you need help. It's always okay to reach out. Avoid caffeine. Caffeine can increase symptoms of anxiety. And check medications, because some medications can increase your anxiety.
Okay, so the overall anxiety rate is 32% from 2001 to 04, and it went up 7.1% in 2020. Majority of the adolescents suffering from anxiety are majority female, 17 to 18. We run around and ask the McFatter student body, have you or someone you know experienced anxiety? 92% responded in yes, and 7% responded in no.
Some signs and symptoms of depression are feelings of sadness or tearfulness. You're frustrated at this very small thing, so you get irritated a lot. You lose interest in your activities that you used to love, like maybe your hobbies or hanging out with friends, so you start to isolate yourself. Additionally, you may feel worthless, have loss of appetite, which will lead to you losing weight, and also have trouble sleeping.
Here are some ways to prevent depression. Handle your stress. Maybe do some journaling or meditation. Take care of yourself. Sleep, brush your teeth, keep up with your hygiene. Reach out if you need to. That's a number that you can reach out to, 741-741. And also your parents or your school guidance counselor, therapist, teachers, there's many people willing to help you. Get medical checkups if you don't feel right. If something feels a little bit off, go get it checked out. And find the coping strategies that work for you. Journaling is not going to work for everybody. You just have to find something that works for you.
Depression is a state of long periods of sadness. Many adolescents struggle with depression. 30% of middle and high schoolers struggle with depression according to Florida Department of Health. We decided to go around the McFatter High School and ask the student body, have them or anyone they know experience depression. 86% responded yes, and 13.5% responded no.
Signs and symptoms of suicide. A person that is suicidal, they will talk about wanting to die, or they will feel like a burden to others. Additionally, they will feel extreme sadness, anxiousness, and have no will to live. They may change in behaviors such as researching ways to die. They may withdraw from friends, give away their important items, start making a will. They may take dangerous risks such as driving super fast, or they may participate in alcohol and drug use.
Let's talk about how to prevent suicide. First, universal screening. Get screened for suicide if you feel like you're suicidal. Know the signs in other people and in yourself, and have a plan if you feel suicidal. Come up with a plan of what you're going to do if you feel suicidal. For example, you might want to initiate coping strategies that were previously planned out by yourself. Go to psychotherapy if you feel that's necessary for yourself.
According to Florida's Department of Children and Families, 3,113 individuals have committed suicide in 2019. The rate from 2019 to 2020 has decreased 10% from the resources provided to prevent suicide. We asked the McFatter student body, have you or someone you know experienced suicidal thoughts? In 600 students, we have 178 responses. The results were 73% responded yes and 27% responded no.
If you need resources to reach out to if you're feeling suicidal, depressed, or anxious, we have some for you. You can go to www.samhsa.gov, or
You can also call 988, which is the Suicide and Crisis Hotline. They are available 24 hours, and you can call or text, and they are proficient in the languages English and Spanish.
You can also visit the ADAA Anxiety and Depression for tips and strategies on how to prevent and cope with your illness. And the B is what you got, and start.
So when you're ready.
She started.
go.
Depression for tips and strategies on how to treat.
You get irritated a lot.
Caffeine can increase symptoms of anxiety. And check medication.
So with anxiety, you're gonna be feeling tense a lot, so you're always worrying. And since you're always worrying, you're gonna be having troubles concentrating on things, since you're constantly worrying.
All right, class, I'm gonna put an equation on the board and I want you guys to solve it.
Is this right?